Hi everyone, Dr. Owens Chiropractic of Bellevue here at our new location on Northup Way, and I wanted to show you how a typical treatment is done in the office. Some of you have curiosities about what an adjustment really is, what we're trying to accomplish. So I wanted to show you what it looks like. Here we have Chris, and Chris a while back became a patient because he was in a motorcycle accident and really torqued his spine out of place. So we've been working with him. His spine is doing a lot better, but he still needs adjustments to keep things in place where it created weaknesses from the accident. Start off with adjusting his neck. I'll show a manual manipulation or a manual chiropractic adjustment as well as the use of the arthrostim as we go. And the big thing when we're adjusting someone is we want to feel where the spine isn't working, where it feels stiff, and that would be where the nerves are having a problem. He has a problem in his upper neck on both sides. So we'll go ahead and give that a light adjustment. That's perfect. A little bit lower on this right side. Perfect. Excellent. Now, when we adjust the middle back, there's different types of adjustments that we can do, but with Chris, he needs this particular type because he has a problem where the bones have been jammed forward. There. I was just feeling where it was, and then I'll have a light contact here and a little pressure to help that move. Let's do the same thing just right below it. Okay, great. Now, let's address the low back. Turn towards me on your side. Lower back is really important to have moving properly and in the correct position, because if it's out of place and one hip's higher than the other, your walking can cause pain in the back. You can develop hip problems, knee problems, all these things. Just generally feel where the problem is, right at L5 on Chris today. And perfect. We do a little adjustment there. Good. Yeah. Now let's go over on your stomach. Face down. So sometimes after the manual manipulation, there's more work that's needed in the spine. But I can't continue to do manual manipulations. The body just won't have it. So that's where the arthrostim comes in. It does the same thing. It gets the bones in the right position, also gets the bones more flexible, but does it with a lighter force. So with Chris, I'm just going to go over the main areas that are having the problem, and it just does a very light tapping, which helps the bones move right into place and become healthier every time that we do it. Good, I can feel that as I push, the spine's becoming more flexible. That's the goal. Okay. So we monitor it before it feels very stiff. After we apply the arthrostim, the area becomes more flexible. That's the goal. That's how we know we've achieved what we wanted to do. Now, just a touch here. That gets the neck in a better position, also helps it to function better. And lastly, we go over the spine with a little vibration therapy called the master massager. This is the patient's favorite part, I think. But it really wakes up the nerves, helps the circulation in the spine. And the better the circulation and the better the nerves are working, the faster that you're going to heal as a patient. All right, Chris, you are all tuned up, my friend, and that's a successful adjustment here at Chiropractic of Bellevue.